chance to show you I can be a teacher, I can be a preacher, eh? So give me some space to prove it. There is ability in this ability. Give me a chance to show you there is ability in this ability. Give me some space to prove it. There is ability in this ability. Give me a chance to show you there is ability in this ability. But give me some space to prove it. Oh, ability in this ability. Oh, just give me a space, give me a space to prove it.
Yeah. My people, and I welcome you on another Saturday now don't enter so and I know it's in time they talk. 3 p.m. every Saturday now they gather day on top this program, on top this podcast, Ability Inside Disability. And this now program where Modupe Afiz Ogun Foundation they carry come to help us understand the inside of different disabilities where they are amongst us. And make on no fear, as just said, I don't see different faces on top this chair today. Our hosts, Mrs. Modupe Afiz Ogun, they a little bit under the weather. We don't they pray for them, and by God's grace, she don't be strong. So, as she say during the program, she feel join us on a see her message as we they talk they go. And my name na Ini Sam, and na me they call Oga Sam. Na me be the autism specialist and special educator. Once again, I want to welcome on this program today. And as usual, I'm not this studio alone. And I suppose know the usual suspects with the follow work out of this program. Some very casual and gallant gentlemen will follow the program. So now I go allow opportunity maybe for introduce themselves before we jump inside the topic when we get to discuss today. All right. Welcome, bro. You see they do me strange for body.
Now you don't charge that.
My people, good afternoon. I may be Dr. Yiji Kumtap, the man with the disappearing and reappearing. I don't reappear.
Well done, my people. My name is Dr. Bako who's been to our episode that did together with us, and I believe say at least we'll go pay attention, we'll go discuss, and we'll go make sense out of the discussion so we'll get to know. Now, well done.
Correct. Anna, thank you. Thank you so much, Dr. Kumtap and Dr. Bako. The fact that they do on top this program, you know the kind of weight they join this program. Of course, you know say for our own climbs, anything where clergyman talk or anything where doctor talk, now almost second to waiting God talk. So and I shall say all our listeners they learn well from waiting they carry come week in week out. And as we enter July, so you get some very key themes, some very key topics we don't they carry give all our listeners. You know, say we be not go far on top the podcast. We don't they talk about different conditions, but we can't track back this July. Say if it be say some people no really understand wetin these special needs mean true. So make we no just dey assume, make we go back, go try clear ground so that everything we wan build on top as we dey go front, people wey dey follow us go understand and they go fit dey follow us at the same speed. So this July we don go back, we don talk about wetin be special needs, we don give some kind pointers the different special needs condition. Last week we Marcon enter talk about physical disabilities. That be our focus last week. We talk about the different conditions we dey consider as physical disabilities. We say okay, person maybe one of in legs, one of in hands, all these conditions where they affect movement, mobility, how person fit take coordinate muscles, coordinating joints, and we've been do justice to that topic. And for all of us now they listen to that, short son I don't see on top the flyer. Say today na sensory disabilities we want to talk about. Sensory. I no go to take too much of the time, make you know be say now only me come to talk today. And I go just want iron out one area. Sensory. Now from the root word sense. You know, say for pidgin, we dey use pidgin for this program. Sense, person go begin touch your head. But sense, now basically the sense organs. When we dey primary school, they know they teach us say, we get 5 sense organs. They say, your eyes, your nose, your ear, your tongue, your skin, different sense organs. But today we will learn gone waiting be sensory disabilities. So I go on hand over to Dr. Yiji Kumtap, make he tell us waiting be sensory disabilities and how it take affect people.
Thank you, Oga Sam,
Yes.
for this question. You say when you talk say sensory, I talk say hi. Now waiting kind of tobacco here. But supposedly I'm making all the talk. Because him na neurologist.
Yeah.
You come from sleeping, go start to talk about that. But to understand sensory disabilities, we need to understand waiting be the sensory system. Which now part of the nervous system.
Okay.
And waiting they do. You don't talk say when we grow up. Now true, not to say even up to now. There are 5
Sense organs.
Everybody don't know. They see, they smell, they hear, they taste, the feeling of the touch, all our sensory. So the sensory system, nervous system, waiting they do. Now just like bridge.
Okay.
Between the external environment, the internal environment, and then the brain.
Okay.
So we get internal environment, we get external environment on one side, then we get brain on the other side. So the sensory system, like the bridge where they connect that one.
Okay.
So what they do essentially now, we say, they collect, they get information.
Okay.
So we they call stimuli. They collect information. So if I touch you now, before you know, say, now somebody touch you.
Yeah.
Now the sensory system go carry that information, transmit them through nerves.
Okay.
Go reach
Brain now.
Brain go interpret them. Then you go come bring them back. Then you go talk, say, they touch.
Correct.
If you put hand for fire, now sensory system will tell you, this is hot temperature.
Oh, okay.
If you see light, the reflection, now the sensory this thing go carry them, go brain, go brain go interpret and say this light na red, this one na white, this one na blue. Then you go come back. Then so all these things now the sensory nervous system.
Okay.
They do them and they take place within microseconds.
Quick. You don't interpret and make you fit.
Very fast.
Oh, okay.
Now why you get people where if they get sensory issues? Make I use example. Diabetes now.
Okay.
It damage their their nerves.
Oh.
So you will see diabetic go fit water they boil. And go fit put hand or put leg.
You don't go feel it.
You no go feel am.
Okay.
Because the
If you imagine.
the sensory this thing there.
Oh, okay.
So from there you go start to imagine waiting the sensory disorders way dey. Because if the sensory system no fit interpret something, it means say you no go dey see well.
I understand.
It means say you know go they smell
Mm-hmm.
well. So you go feel fire they burn. You go to perceive perfume or you know go perceive
Anything.
because your sensory system yes get issue. For the tongue, it get different areas of taste. It gets sweet, it gets sour, it get bitter. But which one? And those ones, ba?
Primarily.
So if you get issues, you go if you put sugar for your mouth,
You know go taste that.
you go if you put bitter leaf for your mouth, you know go taste.
A sensory be that sensory issue.
The same thing with ear. So you know go the here. And don't talk about skin.
Skin,
The bone, you know go.
You know go feel
you
them.
know go feel am. Then even joints too, proprioception. Balance they help.
Okay.
The sensory system they help.
Okay.
Maintain joint position sense and some level of balance. So anything will go affect any of those. This depending on which sensory organ they
Affected.
pathway they affected.
Oh.
How the manifestation go there.
Correct. Thank you so much. I sure say plenty things on the Dr. Bako head now to take on this Yan. Dr. Bako, I beg, make we follow hear you.
Because I just say no, they finish the work for me. In the reform say no. Say that you supposed to come do this work. You can't finish everything. Can't do like that, don't get talk again. Because really, when we talk about sensory disabilities, now just like we talk now to just mention waiting be the primary senses, which are the 5 where we talk. In as much as now we know say some people only create some maybe 6 sense.
Yeah, 7, 8,
7 sense don't exist. But primarily biologically and medically, now those 5 components. Yeah, talking about disabilities that put with all of them now. Just like I said, last in each of the disabilities we will talk about, just as Kumtap just conclude, all of them go end up to that impairment in your sensation, touch, and everything, hearing, go they poor, maybe your vision, or go they total or partial. Now, how most of them they present, and because of this sensory information, where stimulus where they get from the environment, now go at least give you your understanding of space and time within the environment where you did and stuff. But when those sensations they transmit and they coordinate together, you say you'll get a serious problem when you come to that. In which even some people will get some of those disabilities, so they talk even like the autism spectrum disorders. Some of them they get some of those problem because how to merge between some of those senses to make sense of them, because they have to coordinate together, they have to connect together, because sometimes some of you they talk to you, just say person enter your personal space. You don't say get space if you stand, person enter you, they uncomfortable, you want push back. If now you better have they say maybe they give you better message, but maybe you better have somebody enter your space. You will not say, "Car, this one, bro, which kind?"
Just deep first.
You understand? So the orientation in space time is very, very important. So now let's talk about the visual part now. Within the fear affect our visual sensation. And this is either complete. Some of them will be age related, like people they get cataract.
Okay.
Those ones will happen. Yes, those ones are structural problem. If you just go do maybe cataract surgery, if you see. Some people if you get some kind of serious pathology, things if you cause serious biggie, things like maybe say glaucoma.
Okay.
Because they don't manage them well. That one, if your retina will na him be one of the nerves where they carry the sensation of vision to the central nervous system for brain, if they just discharge, that one mostly one of the causes till date, one of the causes of permanent blindness.
Oh,
that one, yes, if you don't move, yes, if you just come out, it will give you permanent blindness. Get some people if you get maybe things like optic neuritis. This is an inflammation of the optic nerve, because primarily in optic nerve then they carry all those sensations to the brain. So maybe if the nerve can be inflamed, maybe due to reaction or maybe autoimmune problem, maybe part of our body they attack itself for certain reasons, so we no fit explain why. Inflammation go set you. See people even the perception of color. Don't like what I talk say if you see light, you go to the brain go interpret. But people who get optic neuritis, their perception of color will get problem. And some people say they even get color blindness. They just feel see everything in grey way. So that means you don't understand. You know, so when they say in black and white, as they don't discern, no bring things plenty. So those ones they really say I'm in black and white. So they don't feel appreciate certain colors. Whenever they get things like optic neuritis, and ordinary conjunctivitis will feel affect your eye. And some age related, maybe with time you'll see your focus and everything from inside if you get problem because of your lens and age, and that's why some of us who come out glass today will not go read book. So him and are part of the visual problem where person fit get. But then the worst one where they day one kind, like the one way maybe they born you with them. Because one, you never get to appreciate certain things about the environment. So as you say, your growth and at least development directly or indirectly must be affected. Because one time when somebody they get that sense of sight to do something, then your own go dey retarded. Because now you have to apply other extra senses. That means they say some people with one sense they look, others they heighten, because you have to do extra to be able to at least make you cover for that one. Let's just say we just talk about the visual components now. In that's why plenty things they will feel that multiple sclerosis and the rest all fear affects them. Because for multiple sclerosis, if you get that disease, you just say you don't get sudden blindness. After a while, maybe after that, give you maybe some steroid medication, the blindness will resolve. You can come back to see again. Oh, you want sweet one? We did very common for our environment. Very stupid and sweet. That be stroke. Come on, if you get this kind of occipital stroke, because our area of vision day for our organ area, this back part of the brain. That the place where they control our vision, be that visual cortex they here. Okay. So if you get stroke, we touch that part of your brain. If you get blindness, or your sensation, appreciation of sight could be very much affected. So you see, they'll carry go ophthalmology, go check. They'll see the structure and everything. They're normal, but you need to see because one, the supply to the area of that blood supply to that part of the brain, they're affected, and with stroke, every minute the cells around that area feed that. And again, that's about those double vision and everything. Ordinarily, small tumor around the pituitary gland. That area they call master gland for brain. If tumor they there, we also they come on. Maybe this called pituitary adenoma. You go feel it compress on the optic nerve because optic nerve they around that area. Okay, you go press them. You go press them because they increase in size. If you press, depending on the area where you touch, you get to kind vision you go see. We get different type. Hemianopia, quadratonopia, different type. They are named plenty.
My people, more than no vessel. You know, say usually would they advise more than carry book and pen. We'll start the podcast. And you see, say we never even pass like 16 minutes on top the program. You don't do so I beg carry book and if your body don't do hot, grab something we could. Find cold water, find soap, sit down. Today home they was packed and I go lay where.
So these are amongst those one other plenty things in there. So now I'm not just jump down. Okay, let's talk about smell now. Let's say from eye to smell, perception of smell and another thing. Ordinarily, say if you get catarrh, that is nasal congestion and everything, smell they impaired. This one are just normal situation following maybe upper respiratory tract infection. If you just get abnormal, that makes some people then get catarrh safe, even to synergize their smell to taste. They get problem. You see, say if they eat food, like say they eat chaff. That's to tell you how you fit. You suppose every sense is supposed to coordinate for you to make sense of what they eat. For some people, like people who get Parkinson's, all those also they call neurodegenerative disease. Person get Parkinson's, sometimes the first symptoms now nausea, loss of smell.
You know, go feel smell.
You know if you smell anything. Now what thing goes? I him you know go feel relate and then now when he can start get stiffness, hand they shake and everything. I go understand. When I got that, I remember the first thing gave me things on a catarrh, him been get loss of smell where they constant until they most times after they get neurodegenerative disease, depend you say smell feel loss. For Parkinson's disease, dementia too. Smell feel loss.
Disabilities, all these things they talk to.
All lines are sensory disabilities. You see if you get Parkinson's disease, sense of smell feel loss. If you get stroke, because depending on area, because every nerve really control all those senses, those especially those 12 cranial nerves, they see go by all their roots inside brain. So anything will affect them. It go send message because now olfactory nerve you know if he gets sensation of smell, he might go affect send back to that area. And again, talking about the tongue again, when I say the tongue get two supply from part of the cranial nerve 7 and the other. So if anything, even a stroke happen inside the brain, you say either half or 2/3 of the tongue no go appreciate this thing or
taste again. You know,
taste at all. You know, feel I'm telling you, make sense at all. You don't make sense at all. There's a sense of smell goes well. Then thinking about that sense touch and like the Dr. Kumtap talk. Diabetes being one of the commonest one. You say we call it diabetic neuropathy. You say you get neuropathy, that's you get problem with your nerves where they around you. To a level of say if you get this general neuropathy or diabetic neuropathy, which most of them are peripheral nerve problem, peripheral neuropathy as a general term. You say ordinary balance, get a problem. Sensation, even then touching, if you keep pin, just like you talk. Some people get diabetes, you see that somebody go tell them, say, they work up blood, they go to your leg. You don't know. Say something not to come. Because the nerve sensation not reduced because of the poorly treated diabetes where they get. They don't manage the diabetes, so it don't affect the nerves well. And so the ordinary syphilis, leprosy, we know so that nerve they attack directly. So sensation of even pain and this thing. Yes, leprosy. They say get leprosy if you took hand like firewood for they discuss with you and yourself. Nothing will happen. You go to juice with them. Maybe something where they smell makes sense like meat. Now I'm going to say, so it's like that. So one of those nerves they are affected. You say touching and everything becomes affected, and you see the coordination of time because even your bend your toe up, you not even know say them bend and go up because it don't affect the peripheral nerve. So you see even waka if you get imbalance, even when you waka because you need to at least appreciate your environment. Proprioception, that's understand Watin for you to be able to really work well. So most of those things, I think basically we don't talk about most of these. So the same thing to ear also. To ear hearing, that one will be partial or total complete. It can come from maybe temporal low problem from stroke, or it may be just be structural, maybe just some of those deaths where the blood, where the fear aspirate come out for person ear. So again, and damage to the nerve, vestibular damage or all those nerve for ear, they might feel come like that. And we need all of this coordination to work, all of those senses to merge together for us to be able to at least appreciate even learning, living, because without them, some of the effect plenty. To the level of depression.
I feel imagine.
Some of the effect plenty.
And at the here, these small sensory disabilities we won't discuss today. And I don't hear how the thing take get roots where we enter plenty road. As Dr. Bako Denyan, as they talk to us, as they educate us, now one other suspects just enter studio. I beg, make you introduce yourself for Boniface. I beg.
Good afternoon. Another Saturday again. God don't bless us with another time. Today, we talk about a serious matter where I want everybody to take pencil, take pen, take book, they write down because this thing if you affect you, if you affect person where they close to you. So if you take all this information down, it will help you. It will also help the people where they are around. My name still
you know they ever change. Welcome, Oga Boniface. Now, as we don't do research to discuss this topic today. For my own side, my own perception now, I can't say it gets some areas of sensory disabilities where they're very common around us, the ones where we really see, the ones where we really know about, and primarily those ones now like what they call visual impairment. Say you see blind person for road, readily you go even know. Say okay, maybe person day where they hold in hand, they waka, or they hold white cane, they tap ground, make it obvious. Then maybe hearing impairments now. Maybe you go work out with in friends, you go see and they move hand, or maybe sit down somewhere, get interpreter, sign language now. We go feel identify those ones. But as I don't learn, say other forms of sensory impairments, other forms of sensory disabilities will move away from these major ones we really see for our society. So now the question what I want to ask now, I go ask Dr. Bako this one.
Yes, sir.
How person fit identify some of these challenges early for small pikin? How you want to know whether your pikin get sensory disability, whether na hearing or whether na sight or whether na proprioceptive way you talk abi how you want to know? Make our listeners for follow learn.
Yeah, as a matter of fact, but the commonest one where easy to detect, even right from when pikin dey small, maybe things like the one of a visual impairment.
Okay.
That one dey very, very easy. In as much as maybe say when the pikin dey like couple of weeks, that one say we had it to understand them. But then you get some basic things so scientifically do for mama, I know say go dey difficult. But thank God say anytime when they give birth to pikin, the doctor they always examine them before they even think of doing them vaccination and subsequently allow them go home. And again, within that period of weeks or so, they will always come to the hospital and they see them. Especially for children with, let's say that this is called pigmentosa, retinitis pigmentosa. If you just carry normal light past, it gets one brightness where the children they get for eye, where they reddish. You just normal light pass around them, you just pick down. If you just sit down and there's high tendency that pikin we get eye problem.
If you pass light for
With
the
normal light
face,
around, just the way they move light, they
the
say
eye go
like
begin red, or you go
will
see
just
something.
appear, especially within that area of the pupils. You will see them very red, abnormal. The way sometimes you will see cat eye or dog eye, which is not normal of what you see for human being. But then if you just pass around it, you see one excessive brightness, redness from the eye. Then if you don't move past, you see the thing will normalize. From there, they will always peak for most of those small children.
Okay.
Yes, but else, subsequently, that just try to instigate, confront, try to bring your hand, whether the picking one bring one respond, hold your hand as it grew. Because this one says that some of those milestones as they develop. So those ones, when you see the beginning for sound, something that happen when you do one excessive sound, picking no response to that, or something play, picking no fear. Those are good. No say, hey, supposed start to the begin. Shout when shadow begin supposed start to, or one sound begin to cry. You know, sometimes we begin this, then do one sound, so we go wake up, just start cry. And you saw this one begin when they play one, maybe they put bomb behind your house, begin to sleep, or begin there like bomb blast, if they become vibration, or maybe vibration. So they don't say that one visual, even proprioception problem. You understand? So some of those small things. I know say go hard for especially woman when I first start she born begin, but woman we first don't grow one begin. When did she grow the second begin? If she start see something, she'll notice how that first one be and how in them be meet up to certain things. Then this one will come meet up. They go no say problem. They just like one patient where Mr. Sam been sent to me because I hear the younger one now. Ready they even I they teach the big one where they even fit talk, they fit coordinate. Picking get one can autism where get superimpose GHG inside. That 5 year way be said one time. So you see most of those, if you just notice, if you don't get the first picking, if you start see the second one, because if that one especially don't get one special need, the second one you gonna say abnormality there, you go notice them quickly. So most time all those confrontational things like try to see something for the picking eye, what are the picking go try to let's say one put there, whether go close the eye, move light, whether the face go respond and stuff like that. And they give one serious startling sound, the beginner respond. We'll go check, we'll go for that. Now basically to go see pediatrician.
Okay.
I want to act with
I beg.
he talk. Like now, we dey fortunate say our health system they ensure say picking from day of birth they give them vaccine.
Okay.
Now imagine say you dey give person picking injection. And picking no
Shake, no cry.
At all.
It's supposed to be pointer. First one, if you be say okay now, first they no understand what terrible word.
Very terrible word.
Then the next dose, they give
Yeah, you know seriously.
know that
There's a problem somewhere.
There's a sensation.
Yes.
Their issue, touch. Then, as children they grow up, I dey remember my 3-year-old daughter. If you give her chocolate, and then you give her bitter leaf, you know say na chocolate she go collect.
Yes.
So if pikin
Collect bitter leaf.
3-year-old they collect bitter
They
leaf,
chew.
am.
Problem there. Simple example. Very sweet example. Yeah.
For smell it may be difficult.
Yes,
You understand?
that is very difficult.
As
They grow in the advance.
Simple techniques you go know say kai problem in addition to what
Thank you. So this is a as Dr. Kumtap just talk this thing now. You don't explain plenty things when you see for some clients who they work with. Again, one boy where they see inside therapy. The boy they chew his own medicine. Now he wants to collect and put from and not be small picking now. You don't enter teenager. It's in the chopper. You don't go even use water. You go chop water. Then on a lighter note, I see one video for social media recently. Then they try wake one guy up. Everybody don't wake up. Then they try wake up. He no wake. They even call person. He come blow trumpet for an ear. Baba still they sleep. People come they shout, they laugh. Then the guy come wake up. They see the blow. He wake up. They look. They say, "Wow, that they shout." So that this one feel explain. Say, "Guy,
Problem. Somehow there's a problem somewhere.
Yeah. Say they blow trumpet for your ear. You know. And I like the way Dr. Bako and Dr. Kumtap take answer these questions. You don't explain how you fit take identify some of these conditions for younger children, especially children who never sabi talk yet.
Yeah.
So you don't even need ask them questions. Okay, small pikin we know the year where you go in back, make sound, make noise. The pikin no even turn. You go no say kai. You get one kind of sensory disability with the year. Then person don't ask question now. Make a quickly make we quickly address am. Person say, which kind advice you go give person wey dey live with diabetes to help prevent long-term vision loss? Also, why children when you get autism they smell their food before they chop am, or they just like to dey smell object, anything wey they see they go carry and go smell am first?
My answer. I do good that you start my answer.
Answer the second part.
Okay.
So the second part now on
Why children they say
children with autism they just like to dey smell things.
autistic especially. No, as a matter of fact, you know, children with autism, them they always get this kind repetitive behavior, and anything they want to do, they will see them to the letter. So any behavior with autism, why it is before we will talk the answers, why it is most of them they excel. They always go extra to anything. How the richest man in the world, autistic. Most of them like that indeed. So even if now toy, then get this attachment to whatever they do. If now their toy with this, then that toy must be their toy. Even if house they born, you guys try to come out that toy. Even if your leg break, as part of the spectrum of their problem, or part of the spectrum of their own problem, where they try always push. So primarily, now the reason be that.
Just to add on waiting in talk. You get one picking where I've been the see for therapy. This boy, waiting he like na pap, and the pap must be maize.
Just imagine.
You go carry millet now.
If you just smell them, that's all. He will chop am. Wow.
That's tell you how heightened their senses.
If you say you go put, if you want put anything, the mama they put only one kind of milk. You get one specific milk where she they buy. If she buy any
Another milk, you no go take
No
am.
collect. That's what they do.
If you mix them, they mix and dawa or whatever, you know go chop.
You know do again.
I tell you.
so they're just used to
A particular thing.
Yeah.
They are used to a particular thing, and they wouldn't want you to change it.
Make I follow shook mouth for this thing. Sharp. Then we will address one more question where person don't ask. Now, for my journey to the work with children, we get different special needs conditions. I don't meet some kind of children too. You get one. That time when I begin the work with them, if the food where you give them, no they burning hot, you know go chop them. So just like this person asks why didn't they like smell food, this one ain't go smell them first, then carry on, keep them on top in mouth for here like this.
What I go burn 'em.
Yes, temperature now. I know if you hold the plate where in the chop.
Wow.
As in the plate go hot in myself, as in they put out for mouth now. So
Fast.
if the food no
But
be like
that's
that,
like
you no
am.
go chop am. It go just carry and put for here, then push and give you. So now you feel connect them, and research don't show and say plenty children wey dey on the autism spectrum they follow get sensory processing issues.
Yeah.
They follow get issues like wetin Dr. Kumtap and Dr. Bako don talk today. The way their brain dey interpret stimuli from environment they dey different. So quick, this person say good afternoon. Please, why is it that those that have Down syndrome and autism look alike regardless of their background? This one no be something we will suppose focus so much on, because today we dey talk about sensory impairment. Now I go want clear the air. Now people when get Down syndrome, they get physical outlook. Say the face round, the eyes slant small, the ear small, the neck thick, and the rest. People when get autism now, until they behave or
now
act out,
know.
now you go know. People when get autism, nothing they show for their body say they get autism. I should say I don't answer your question, Mr. Yahaya. Mr. Yahaya, ba? Okay. The question on diabetes now. How do Dr. Kumtap?
So, as we know, diabetes now sickness we they occur because sugar plenty for the person our body. Sugar na energy. Glucose na energy. Because if you want check your blood sugar, now glucose you want check.
Okay.
Na energy, but na energy way we know defeat use. The body will have to convert that glucose into usable energy. That's ATP. And now insulin they change them.
Okay.
So the diabetes they occur as a result of either lack of insulin or you get insulin but insulin no they function.
Oh, okay.
Aha, now the basic things really cause diabetes mellitus. So sugar they go they up, and the sugar they damage
Different.
practically all the organs of the body, from your head to the sole of your feet. Diabetes, they affect all organs. They cause stroke, they cause blindness, right? If you cause sensory issues with touching, you get problem. They cause heart problems. In fact, some people, because of the way it affects, we don't talk too much about the internal sensory distance. So then they chop food, they normal, then they sweat. Immediately after chopping, they go vomit. Or then they get pain to swallow food. On a sensory,
internal now, inside.
Yeah. You will chop food, you will be too bloated.
Belegu sweat now.
The sensory this, they allowed peristaltic this thing. They
made the food digest now.
They feel reflect as constipation. Sometimes again for night, they pass loose. Only for night they pass diarrhea. For daytime so all these things na sensory this. Yeah. So how for diabetes, how you go take control them now? We say may your blood sugar be within normal
range.
It's supposed to be preferably less than 6. So how you go take do dieting day? Because if you chop food, we get plenty carbohydrate, sugar go plenty. So people that's the control your diet. You get rule of thumb, you know the rule of fist.
The whole hand. Fist.
So your carbohydrate intake you not supposed to pass the size of the fist.
You not supposed to plenty pass like this.
Not supposed to
Because to some people like this now the first no.
Now that is test.
First thing you chop first.
So that
The real food.
the second thing now, activity. The more you are active, the more your body, the sensitivity of your body to insulin gets better. So the sugar no go.
Like exercise now.
Very good. And of course, lastly, if you deal on medications, you suppose they take your medication.
medications.
So some we may even have to give them insulin because if you don't get insulin completely, then the only way we just give you synthetic insulin. So the way and manner you control your blood sugar is very, very
important.
Because if you don't control it, all these things what we mentioned will happen to you.
Kai, my people now don't hear ba. You get one quote where I read some years back. They say, if you don't make your food your medicine, small time medicine go become your own food. So as also I don't hear that one. Thank you so much, Dr. Kumtap. Now make we move go front small. Make we discuss management. So now on adult families, parents, you don't see say Kai, your pikin fit get one sensory disability or the other, or you don't see pikin for your environment, class teacher or school administrator or caregiver, in short your nephew, you notice say Kai difference is there. Una don't go hospital, they don't help una diagnose. Now Oga Boniface, Watin which kind of supports they are available to take help individuals who get these sensory disabilities?
Accommodations we person we get these sensory disabilities, they Bako, they plenty. Accommodations where you supposed to take note of. But I go start with auditory.
I bet make you break and down. Yeah, no verse.
When you notice say you get hearing problems, when you notice say your pikin or the child we there for your class get hearing problems, you get some few things where you go put as modalities. We say you go help them. Because the sensory problem don't start to affect in learning. It don't start to affect his social interaction. It affect everything about his growth and development. So you get some things with teachers. So number one, if you notice say a child they over responsive or hyperactive to a certain kind of sound, maybe say if he hear that sound, he goes just run into especially children where they on the spectrum, children will get ADHD. If you notice say they respond too much to sound, you feel use what they call ear defenders. Ear defenders. If you these ear defenders, they look like earphone.
Like earphone,
yeah,
okay.
They look like ear headsets, understand? But they know they play music through them. It just they close the ear. They reduce the intensity.
Oh, okay.
They call ear defenders.
Okay.
So also you fit take that child away from the source of sound. You know, the more distance where they give sound, the less the impact of the sound. So if that sound must be for inside that class or dey for inside that, it's not compulsory. Say that sound, no go fit take come out from that place. You go you go place the child sitting position at least some distance away from that particular sound. Make you no be say now betting the trigger the picking all the time. If the child they over responsive to lighting, light, not be by force where you go keep bulb inside class. You go feel use natural classroom light.
Okay.
You open windows. You understand? Use natural classroom light. Maybe say if he accommodate to his special needs or special conditions. Some of these sensory issues, if you just take note of them, you will feel eliminate some of the impact they cause for that particular picking. And I know say our doctors there, they get
okay.
Just stop here.
Don't worry, even where you stop, so you don't do well. You don't get pass mark. I've been get one colleague when I do my first degree. If they say that they read, he go they ask you. When I won't get it, he go they love you. He say me I don't read, I go feel collect my D they go out. So now you don't at least you don't go pay. So you know say today under these sensory disabilities, our focus really strong on top of people who get conditions like this: visual loss, visual impairment, blindness, partial sightedness, hearing loss, hard of hearing. Those ones where Bako where make themselves follow benefit from this ability inside disability program. You understand? So make I just add one small thing on top within Oga Boniface don't talk now. You know say different assistive devices follow day where they use take support. Make us start with people who get visual impairment now, either partial or complete loss of vision. For instance, Pekin where they don't go hospital, they don't go ENT unit now, they don't go test the Pekin hearing sight. She say, "Kai, you still get residual, small still remain. No, you never bad finish." They fit give corrective lenses. If you give a glass, so we say if you wear them, you go feel see board. If you wear them, in handwriting go begin coordinate. In outcomes, educational outcomes go improve just because say una don't give am prosthetic something we don't help and see road, right? For people we get total blindness, what you call blindness now, different supports follow the. I should say una don't hear of braille. Now the system where people when get blindness they use take read. So instead of for our own they read prints, black ink on white paper or any colored ink on white paper, but for their own the paper na like embossment, na like dots where we say they go just use their hand they feel and they go feel read everything where normal typical person go read on top print. And for some of them, some accommodations na say they feel they record waiting the teacher they talk because they feel struggle to write, or even the brailing now their speed fit no carry everything. They fit no follow waiting the teacher they talk in real time, so they feel record them. Their private time they go put earphone, put them for ear, listen, and then they learn. They learn. Then for people who get hearing loss, either hard of hearing, then or deafness, complete deafness, different strategies follow the. And so presently I get one amazing client, small girl. She they use hearing aid. And recently they fit that hearing aid giver, and gradually she don't they pick sounds, words don't they come small, and this na pikin we born with the condition. But now with the hearing aid, she mad on the perceive sound and the rest. Her condition, her learning, everything don't improve just because of those little things here and there. For people where they totally deaf, alternative means of communication now there now in sign language they come in, and of course you deaf no means say you no go feel write or you no go feel read. Alternative strategies, they plenty things they will feel put in place to help even people when get these sensory disabilities to take learn. I know say Oga Boniface been one push the thing give Dr. Bako. So Dr. Bako feel choke about it now.
Maybe I want just one or two. Like those way they talk about the hearing problem, depending on the causes. Depending on waiting cause that very hearing problem, then fit most patients if you get the normal hearing aid, maybe my cochlear problem. I'm happy areas like Jude give you the corner where they'll do cochlear transplants, even to the hearing area, because we get funny, tiny, the smallest bones in the body, then there's a ear. They just be like incus and the rest, where they do hammer, those tiny guys. So anytime there's a problem, especially depending on cause, maybe then they fix, maybe say if it vibrate to hit the tympanic membrane, then they always change most of those things. And yet, like now, advances they happen, though some of them still they experimental, because using this AI time and everything, they've been able to at least using the visual cortex attach certain this thing around this temporal this bone for this behind our ear.
This mastoid bone.
Mastoid bone. People they fit appreciate movement.
And sound.
Yes, but now see the experimental, but they do them already. With time, we believe so those things go advance. So now some of those things will they pray. Say, may God help science, so that we go feel advance this cause, and people need to see, people need to hear. Totally, it go better for them the soonest.
Kai, Dr. Bako, thank you so much. You know, say this thing where you don't talk now. Recently, I don't see some kind new designs for earphones, and maybe said you know go even need put for your ear. They put a earpiece to stimulate this bone, and from this bone it go bypass those three small bones.
Rhinestones and all those mastoid area they try to check whether they understand vibration. So now there they take advantage of.
Correct. So now I go on ask Dr. Kumtap this question now. I know say even Oga Boniface go get waiting to fit through inside. With all these sensory disabilities what we don't talk about now, how if it take affect both the pikin and the family and society generally? How these conditions fit take affect the pikin, your own family, parents, siblings, and society?
Yeah, of course, it will affect for the pikin. Now, you get tendency where the pikin go feel say he no belong, like say he abnormal. So it can affect the child's psyche. The king go feed the thing say, me, why I know they see, or why I know they hear, or why I know they smell, or if it taste, or something. So if it affect the Peking ability, if you know the environment where they supportive. One be that. And the same way where the Peking they go feed they affected, now it's the same way where the family will they affected. Now imagine say you person get Peking, or him get say 4 children or 5 children, then the 5th one now can't get this issue. It means say the family too, hearing for hearing loss for instance, it means say that to communicate them might and guys go learn sign language. True. So it will affect communication for even the family level. Of course, we get schools where the people go, but go feed the
parents now go need learn.
So it will affect that communication also within the circle, within the
home environment.
Now, unfortunately, if we call the society, we know the support
these kind differences,
disabilities, whatever kind of disability, then problem.
Serious
work.
You go school finish nothing.
So those things it affects. Of
Okay.
course, it affects.
Then
It affects from the individual to this to
so now how the health sector and even government fit come inside now, can help all these people when get sensory disabilities?
Government got plenty work to do in this regards, because the unfortunate thing, I guess maybe Bako go either agree or refute them. Now we say the cost of care, or the cost of treatment for any of these things, they expensive.
Very, very.
We will talk about cochlear transplant or even imagine that.
No be small money.
Now millions.
No be small money.
Millions.
Now millions. Now how many families go fit come out?
Seriously.
That kind of money go.
It's very costly.
Money go. Yes, we get 1 or 2 schools for the deaf. We get for people who get
visual impairment.
Impairment. But outside of that one,
What about the other disabilities?
what about the
Other sensory.
And then are they enough? Those schools are they enough? If I did lantern and then my pikin no they hear, I gas carry and come
Just.
We go call see help.
So as government they build schools, I feel say you get every local government suppose get
At least.
school where they accommodate such
Yes, those special needs people.
those special. So people, government will fit help in that. For the health sector now, still government get
Hand inside.
hand inside because insurance now something health insurance are something we will continue
To talk about Taba.
talk about because the cost of care is humongous with people who fit afford.
Okay, thank you so much, Dr. Bako. You got anything to add before we follow here from?
No, I
Boniface?
think Oga Kumtap don't cover everything because, but at level just as in talking, because those things have to even start at the level of policy development, to the level of even our budgetary allocations and everything. Because we're not going to say maybe just build only one school, say, especially at the level of local government. Because you be a big lie to tell me that in each local government, no children will be blind. You understand? It will be a big lie. And the children, they have to force them. Some of them don't go to the school at all again. Or they have to be forced to go to school where nobody will give them attention. I will not be as a pastime or the waste time. You understand? So it should be a policy thing, say every local government, even if they say they go build different school, but even the school where they get must get provision for these special people.
Correct.
So that at least even one special educator or teacher with all those their blaze or whatever where they feel impute, teachers supposed they way but they handle that. But if I don't feed them at the level of local government, at least even for how do they put all those social secretarial zones, say at least make it day. May not be so only one side.
That local government because you see, but those child
Majority of them they down there.
they go there.
Seriously, yes.
They need them now.
So imagine saying you
Small picking, you can't carry and travel.
Good. If you come, I want to discuss with the family because the family have to also be learning. Just the way you talk. Yes. Them man they must feed they learn.
They give input.
Not true.
Because now just
If you learn, come we want to discuss with us. Them man guys get some input, so the school guys they closer. So that the family itself will follow the learn.
Now better talk. Oga Boniface, you man a pillar for educational sector. Make we hear from you. How they want to how they want to support these individuals with sensory disabilities for school environments and for educational sector.
You see, the issue where we talk about na serious issue, na very sensitive issue because na sensory issue. So for that pikin, you know, say you been asked initial question how the thing they affect the pikin life and the family. You know, say we don't talk say all the senses must mesh together. Make every information when we get from my environment make sense. Already, if one sense they fall, the other ones they try patch up.
Yeah.
Say learning go dey distorted.
Yeah, go they distorted.
Even speech, most of the challenges where they face, especially some of the clients who I don't meet, I don't notice say they get auditory processing challenges, auditory disorders. You understand? And some of them they get visual disorder, join dyslexia, join so many, and that's why all those accommodations we talk they very necessary. So if they affect the child's learning, if they affect social interaction, you go see say the child go they withdraw himself, not be saying he get autism, but because say the thing sensory issues, you know they coordinate them well. So that one follow join. How did they affect family? Already, you know the cost of therapy, the cost of all this the attention where they need. It go affect the family financially. That's the truth. If you notice say your pikin don't get so challenges, you just prepare your heart to say money go come out, yes. But I don't want to make people just they fear. Because if you spend money, you get attention, get results. Now it be the
don't solve problem be that.
In fact, money, the purpose of money be to solve problem. Not be just to keep am for bank.
Yeah.
You understand? Now to solve problem. So that one day. Now how we go fee come enter they help these people. This podcast we dey do na number one. Information dey very very key. If you no know say this problem dey, you go dey beat the child every time. You go dey frustrate the pikin. The pikin go move from one sensory disorder into
another one,
another disorder. You can't get plenty things where they handle. So first of all, information they necessary. And I'd want to advise people where don't they follow us. Meet, or if you see other people where get this issue, advise them make they follow us. Because what we they do here now free education. Free, very. In fact, the university where they are free. So information they very important. Secondly, I want to urge everybody. Maybe say you know you get pikin or you get person we get disability. Now you go be better advocate for that particular.
They talk for those people.
If you know come out, only us where they talk, our voice is you get distance where you go reach. You understand? In fact, person where they outside no go fit hear us. But if all of us join mouth, they talk one thing. Even government where Dr. Kumtap they talk about and Dr. Bako they talk about, they go join mouth do the thing. They go join their mouth, see what thing they go fit do about these children. You understand? So I just these few
with these few points of yours. Okay, Boniface, thank you so much. I you know say time no dey ever reach us when we sit down for studio like this. Say we want sit down dissect these different conditions. So right now I go on make everybody when they studio give one recommendation, one suggestion. May we use that one take go house. You know say. Inside our listeners, we get teachers, we get fathers, we get mothers, we get school principals, we get medical doctors, people from all walks of life. They follow, you know, the power of media now. You don't know who they join us inside this program. So, I should say themselves don't define waiting to take go home. So, which recommendation, one thing, just one thing, where you want to give them? Say if you meet person who get sensory disabilities, what if you do to support them? Make we use that one take end our show for today.
Yeah, I'm a Christian, so love is the greatest. I think if we meet anybody we get any of these sensory disorders, maybe we know say nobody if God tell me say make if I see God talk say you can't mold yourself. I know now white man for you. There's no I don't know say I never see any human being will go talk say him want me anything bad happen to him. Supposed to understand say no be anybody which no be the person so more we just show them
love
and then let us support.
Thank you.
How? When I well done, my people. As a matter of fact, at least when situations like this don't happen, last we will try CC with a beg, just from all quotas, from the government level down to the family, to the school, the educators and everything. With the say every person we get school, at least try to see how to imbibe and at least notice most of those children will get some kind of special needs, so that at least we'll give them extra time to take care of them. At the government level, we'll pray say at least even in the making of policy, they will try to see how to carry imbibe to see say at least these persons, no matter where they will get that help when they want. Now human beings like us, despite the problems that they get. And from our own level, even at the level of parents, all of those things we predispose our children, even in the event of pregnancy, we'll try to see how we'll push them down so that those children will not go come with complications. When I well done, we'll see you next week.
Correct. Boniface. Sharp.
I only say make we be more empathetic. Make we be more empathetic. Because the thing boils down to if you be empathetic, you go to find ways how I go feel help solve this thing. You too might go to search for information to help that person. So the main point where I want to push, make everybody join. Even government suppose they're empathetic.
Yeah.
Now that empathy will bring them into this matter. So everybody, just they always seek out. If you see say this person get challenged, try to find out how I go fit help am. Some the help wey you go even fit give person na recommend am to this channel. Tell am say make he listen to this channel, he will get help. And from there you go start, you will see how the thing will be better for the person. My people are getting now.
Better talk. So, my people, I don't hear ba. With this one now, we will bring today's show reach end. And I thank you very well. So on join, so on even follow us. You don't reach end. I don't know if you wait to see on next week, because inside that next week we will bring another amazing and another lovely concept we want to discuss inside this special needs community. And more than not forget, every last Saturday of the month we dey do question and answers. So even question where you get from today on, make you write am down. Last Saturday, we no go bring any new topic. We go just sit down, answer all of our questions, and provide any support we will fit provide from this our end. So, on our bye-bye, we go stop from here. My name na Ini Sam, aka Ogasa.